So there is a fracture known as Coles fracture. And there is also what we call Smith's fracture. Coles fracture and then Smith's fracture. Smith's fracture is the opposite of Coles fracture. For example, this is the distal aspect of the radius. This is the distal aspect of the radius. So when you fall on an outstretched arm, when you're falling down and you outstretch your arm such that your palm touches the floor, the force transmitted through the radius is going to fracture the distal aspect of the radius. And when a fracture occurs, we have, this is what we call a proximal segment, and this is what we call a distal segment. So this fracture has a proximal segment and a distal segment. So when you fall on an outstretched arm, you're going to have a fracture in the distal aspect of the radius bone, whereby the distal segment is going to be displaced posteriorly and the proximal segment is going to be displaced anteriorly. The distal segment is going to be displaced posteriorly and the proximal segment is going to be displaced anteriorly. This is what we call the Coles fracture. However, when you fall in such a way that the dorsum of the hand or the posterior aspect of the hand is the one which touches the floor, you're going to get a reverse, in which whereby the proximal segment is going to displace posteriorly and the distal segment is going to displace anteriorly. This is a reverse of this, and this is what we call Smith's fracture. So these fractures occur at the distal aspect of the radius. Coles fracture presents with a condition known as the dinner fork deformity. This hand will look like a dinner fork. You see the distal segment displacing posteriorly, causing this bump which looks like a dinner fork. That's why they call it a dinner fork deformity. So this distal segment displaces posteriorly and the proximal segment displaces anteriorly in Coles fracture, whereas Smith's fracture is the opposite. So you go and read about those fractures. They are very common in the distal aspect of the radius. When you were looking at the carpal bones, I hope you looked at the carpal bones. They have two rows, a proximal row and a distal row. A proximal row and a distal row. And we saw that the proximal row articulates with the radius and the ulnar at the wrist joint. So the wrist joint will have the radius and the ulnar proximally, and distally will have the proximal row of these carpal bones. And this is the wrist joint. And in between the carpal bones, we have what we call intercarpal joints. The intercarpal joints are these joints in between the carpal bones. They are complex, but this is the largest one, the intercarpal joints. The largest one is when is between the proximal row and the distal row. So this is where you have the intercarpal joints. But they also have joints in between each other. There's a joint between the proximal and distal row, this intercarpal joint, and then there are also joints in between each of these carpal bones. So the proximal row, we have the pisiform bone, the triquilateral bone, the lunate, and the scaphoid laterally, because this is the lateral aspect, the medial aspect. Then the distal row, we have the hamate. This hamate has a hook, it is hooked. And then we have the capitate, the trapezoid, and the trapezium. Then between the distal row of the carpal bones and the metacarpal bones, we have the metacarpal joints. These are the metacarpal joints. The arrangement of these joints, these bones, is very, very, very important, because when they fracture, these bones usually fracture, and you must know which bone that you are looking at. It's very important to know that you're looking at bones of the proximal row or the distal row, because they usually fracture. So we have the intercarpal joints. Then we have the carpal, metacarpal joints. Then we have the interphalangeal joints. These are the interphalangeal joints because they are in between the phalanges. And this is the carpal. This is the metacarpal phalangeal joints. So, intercarpal joints, carpal, metacarpal joints, metacarpal phalangeal joints, and these are the interphalangeal joints. You're going to find out that digit number 5, which is the small finger, digit number 4, which is the ring finger, digit number 3, which is the middle finger, and digit number 2, which is the index finger, they have 3 phalanges and 2 interphalangeal joints. This is a proximal interphalangeal joint, and this is a distal interphalangeal joint. Whereas digit number 1, which is a thumb, has 2 phalanges and only 1 interphalangeal joint, which is indicated here. The phalanges have a head, the head is distal, and they have a base, which is proximal. So when I talk about the base of a phalanx, I'm talking about this part, and the head, I'm talking about that part. Even the distal phalanx has a head and a base. Even the metacarpals have a head and a base. The bases are always proximal and the heads are distal. So you can even use X-ray images to identify these bones. You can use X-ray images to identify these bones. The lateral aspect, we have the scaphoid. This bone is the scaphoid, and then the trapezium. And then laterally, we have the pisiform and the hamate. Medially, laterally, we have the scaphoid and the trapezium. And laterally, we have the pisiform and the hamate. Medially, we're having the pisiform and the hamate. And laterally, we're having the scaphoid and the trapezium. And that scaphoid looks like a boat. The word scaphoid means boat-like. So laterally, you have the scaphoid and the trapezium. Medially, you have the pisiform and the hamate. And that bone hamate has a hook. It is hooked. So these are the ones I've been talking about. The lateral ones, scaphoid and trapezium. Medial ones, pisiform and hamate. See, this triquilateral overlaps the pisiform. That is why when you look at this X-ray, are together like that. But the pisiform is that one there, and the hamate is that. So you must also be able to identify them on X-ray. This is the wrist joint between the radius and ulna proximally and the proximal row of carpal bones. These are the intercarpal joints. These are the carpal metacarpal joints. These are the metacarpal phalangeal joints, and these are the interphalangeal joints. You can see the bases and the heads, and you can see the two phalanges of the thumb, and the rest of the digits have 3 phalanges. In between, you have muscles and connective tissue. When you fall on an outstretched arm, like in Cole's fracture, the pressure which comes through the radius can also fracture the scaphoid bone. This format of falling can also lead to fractures of the scaphoid bone. Now, why should we worry about the fracture of the scaphoid bone? For example, when you look at an X-ray, you're going to see that this is the scaphoid bone, this is the trapezium. This is the pisiform medially, this is the hamate. It is even hooked. So you can see the scaphoid bone has been fractured. Why do we worry about this fracture? The scaphoid bone is resupplied by the radial artery, both anteriorly and posteriorly. So when the scaphoid bone fractures, the fracture is going to injure the artery, and blood supply is going to be cut off from the scaphoid bone. And if this bone is no longer receiving blood, it's going to die off. It's going to die off. And when these tissues begin to die off because of cut off of blood supply as a result of the fracture which has injured the blood vessels, we are going to have a condition known as the avascular. Avascular means that no longer receiving blood. Necrosis means death of tissue. Avascular necrosis of the scaphoid bone. And because the scaphoid bone is participating in the wrist joint, you're going to have degeneration of the joint so that it becomes weak and painful. Fractures of the scaphoid injure its blood supply, avascular necrosis sets in, and you have a degenerative joint. It's very important. This lecture is going to be very short, so that's why I'm just moving through like that. We have begun with the Smith's and Cole's fracture. Then we looked at the bones of the hand and the joints in between them. And I've emphasized the fact that you must identify them both in gross anatomy images and radiological images, because that is what you're going to be looking at. Remember, the small finger is digit number 5, the thumb is digit number 1. A sesamoid bone is a bone within the tendons. So those tendons going to the thumb like flexor pollicis longus, within them you have a sesamoid bone to ease the movement of the joint. And I've said how the fractures of the scaphoid can lead to avascular necrosis of the scaphoid bone, leading to degenerative disease of the wrist. The hamate bone is the bone which is medial. You must first know where the bone is. On the medial aspect, you have the pisiform bone and the hamate bone. You have the pisiform bone and the hamate bone. I can see its hook there. You go back and come back and look at the bones using our skeletons here. So you are having our hamate bone there and the pisiform around there. Now, why am I looking at the hamate bone? Why am I looking at the hamate bone? This is the pisiform, this is the hamate. This is the pisiform, this is the hamate. There is a ligament which joins the pisiform bone with the hamate bone. There is a ligament which joins the pisiform bone and the hamate bone. Now, that ligament is known as the piso-hamate ligament. The piso-hamate ligament. It's a ligament between the pisiform bone and the hamate bone on the medial aspect of the wrist. So this is the piso-hamate ligament between the pisiform bone and the hook of the hamate. It's known as the piso-hamate ligament. Below the piso-hamate ligament, the ulnar nerve passes. The ulnar nerve passes below the piso-hamate ligament, as it is going to supply these two fingers, the ring finger and the small finger. Generally, this ulnar nerve supplies the medial third of the hand, the small finger and the ring finger. So when the ulnar nerve is passing below the piso-hamate ligament, that channel is known as Guyon's canal. Guyon's canal. That is the channel below which the ulnar nerve passes. That is below the piso-hamate ligament on the medial aspect of the wrist. It's Guyon's canal. So Guyon's canal is made up of the piso-hamate ligament, which is the roof. The floor is made up of the pisiform bone and the hamate bone. And the content of the Guyon's canal is the ulnar nerve. Now, why are we talking about that Guyon's canal? The hamate can fracture. The hook of the hamate can fracture. Can have fractures of the hamate. The fractures of the hamate are going to lead to the compression of the ulnar nerve. Fractures of the hamate are going to lead to the compression of the ulnar nerve as it is passing through the Guyon's canal. So that is the danger. So when the hamate fractures, the ulnar nerve can be compressed as it's passing through the Guyon's canal. So you're going to sense pain on the medial aspect of the wrist. And also, because the ulnar nerve is supplying these lateral two fingers, you're going to have numbness, loss of sensations, weakness in the muscles because the nerve is being compressed, and tingling. Tingling, you're going to sense as though you're having pin pricks. So that is what we call Guyon's canal syndrome, whereby there is a fracture of the hamate preceded by the compression of the ulnar nerve as it passes through the Guyon's canal below the piso-hamate ligament. And when the ulnar nerve is compressed, you're going to get pain on the medial aspect of the wrist, numbness, loss of sensations, pin pricks, tinglings of the ring and little fingers, and then weakness. The surgical operation is done to decompress the nerve because what is bringing these effects is the compression of the nerve. So these clinical aspects are very, very important. The two fractures of the distal radius, the joints of the hand from the wrist joint to the intercarpal joints to the carpal metacarpal joints to the interphalangeal joints. Fractures like fractures of the scaphoid, leading to avascular necrosis of the bone and degenerative disease of the wrist joint. Then the Guyon's canal and the fractures of the hamate are very, very important. You go and read about them. Muscles of the hand. That hand has muscles. When you look at the hand has small muscles, as you can see. This bulge, when you stretch out your hand, there is a bulge at the base of the thumb. This bulge is made up of muscles, and those are known as muscles of the thenar eminence. This is what we call the thenar eminence. You're going to look at the muscles of the thenar eminence. Then we look at the muscles of the hypothenar eminence. This is the thenar eminence. The muscles of the thenar eminence act on the thumb, and the muscles of the hypothenar eminence act on the small finger. So you're going to look at muscles of the thenar eminence and muscles of the hypothenar eminence. These are the muscles which are located in the hand. Then you look at the muscles known as lumbricals. These muscles lumbricals are attached to the tendons of the flexor digitorum profundus. These muscles are known as the lumbricals. I say muscles of the thenar eminence, muscles of the hypothenar eminence. Then you look at muscles known as lumbricals, and then you look at muscles known as interosseous muscles. Interosseous muscles are in between the metacarpals. You can see these are metacarpals. So in between them we have these muscles known as interosseous muscles. And we have two types of interosseous muscles. The ones at the back known as the dorsal interosseous, and the ones at the front known as the palmar interosseous. So in this time, as we conclude the musculoskeletal anatomy of the upper limb, read about the muscles of the thenar eminence, the muscles of the hypothenar eminence, the lumbricals, and the interosseous muscles, the dorsal and the palmar.